Whether you are just getting out of the hospital or maybe going through the natural stages of aging, having a little help at home sure can be nice. Now, there's a big difference between two types of services that are very alike in name: home health and in-home care. Have a look. Alicia Simcox with InHome Health is back. Alicia, thanks so much for coming back on the show. I know sometimes I scare her. I like to give her some tough questions. But today, we're talking about the differences between in-home care and home health care. There are some differences, so a very easy question. What is home health care?
Home health care is physical therapy, occupational therapy, skilled nursing, speech therapy. There's a lot to it. But those are kind of the main components of it.
And it's kind of a very unique situation when someone needs home health after a hospital stay. Paint a picture of what someone needs.
So someone would need home health. Someone that would need home health is someone like just got out of the hospital, had a fall, maybe broke their hip, broke their arm, something like that, and they're not able to really go in outside of their home because they're so debilitated.
Yeah.
So basically, we would come into the home and provide those therapies for them if they're not able to leave their home. It has to be a taxing effort for them to leave.
Right, so there's the qualifications out of the hospital, and then a doctor orders this type of treatment for them in their home.
Yes.
Okay, great.
Yeah.
So you have that. It's very skilled. As you said, there's physical therapy, speech therapy, where in-home care is much different. In-home care is activities of daily living, things we do without maybe thinking twice. Bathing, personal care, housekeeping, meal preparation, transportation, and that's something that Lend a Hand does. So as some of you know, I work at Lend a Hand too, and we get phone calls all the time. Well, I need a physical therapist. Well, that's not what we do. That is an in-home health type of thing, where in-home care, it's activities of daily living, non-skilled work, basically.
Yep. That's exactly it.
That's exactly it. There's my little tirade. No, so back to Eden. When patients get these orders, okay, you need home health. What's the next steps for them after they know they need it?
So the first step would be to kind of look at all your different home health agencies that you have available. There are a bunch of different home health agencies. As for Eden, if we received a phone call, either myself or somebody in the office, we would then make sure that we have all the proper things, an order, face-to-face, making sure that a doctor actually did see you, and just making sure, kind of doing our overall evaluation to see if you're appropriate for home health.
And it's a Medicare provided benefit.
Yes, it is.
Which is pretty incredible. That's home health care. In-home care, private pay, long-term care insurance, not covered by Medicare, but I'm sure someday they'll probably look into that.
Hopefully.
Yeah. Great, Alicia. Thank you so much for coming on the show again.
Of course.
Alicia,
thank you so much.
To wrap up, home health is paid for by Medicare with doctor's orders, typically after a hospitalization. And in-home care is help with activities of daily living paid out of pocket or long-term care insurance. And remember, you have a choice when picking which agency to use for these important services. Shop around, ask questions like, what makes you stand out and how long have you been in the area? What is your cancellation policy? And what are your hourly minimums? These questions will help you pick which in-home care or home health agency is best for you.